Assalamualaikum. This is the second part for lecture 8. I'm going to talk on the license here and the legislation for medical laboratory in Malaysia. First, in Malaysia, we have the Pathology Laboratory Act 2007, Act 674. The Act has 13 parts and provides for control of the pathology laboratory through approval to establish and maintain, and also licensing to operate or provide the service. The approval or license may only be issued if the entity includes a registered medical practitioner. So this means any medical lab need to have a pathologist or medical practitioner in the organisation before they can have the license to operate. And the lab also need to follow the quality and competence requirements similar to those of laboratory accreditation MSI ISO 15189. So these technical aspects I have discussed earlier in lecture part 1. Act 674 seeks to ensure laboratory is accountable to the public, meets required standards of practice similar to 15189, participates in quality assurance programs, and they are run by qualified staff which include pathologists, medical scientists, and medical technologists. Complies with safety requirements and subject to continuous audit for quality and competence requirements. So they will be assessed from time to time to make sure that the lab that are given the approval and license is maintaining their quality and competence. Second, we have the Allied Health Professions Act 2016, Act 774. The Act has 8 parts in it. The main reason for the Act being established is to make sure that all the allied health practitioners is registered for practice. That means they need to be registered before they can practice. Act 774 is to provide for the registration of persons practicing as allied health practitioners and persons carrying out activities relating to allied health, and to regulate the practice of allied health professions and for relating matters. Act 774 seeks for regulation and control of the practice of allied health professions. First, to protect the profession from a person who is unqualified to practice. And second, to protect the public from unqualified and bogus practitioner and abuse of knowledge and unprofessional conduct by legitimate practitioner. So before the allied health practitioner can register as register and then practice, they need to comply with a few requirements, which includes citizens of Malaysia. They possess the recognized qualification which is recognized by the Allied Health Council, and then they have not been convicted for any fraud, dishonesty, or moral offence which leads to imprisonment of more than 2 years. So those are among the criteria for them to be able to be registered as allied health practitioners. Here is the required reading for this lecture. Assalamualaikum and thank you very much.